Hi there, Karl Baker and Bob Wambolt here with Baker CFO Advisory, doing another short video on common problems and challenges that we see. So, as I've mentioned, we have a deep background in working with healthcare providers, hospitals, senior living facilities, community health centers, FQHCs, etc. And sometimes we get hired exclusively to help an enterprise either on an interim basis or on a consulting basis with a company's revenue cycle department. So we thought we'd do a short video on lessons learned. I'm going to turn it over to Bob. Bob, when you go into an enterprise, I certainly have seen it from my level as well, but frankly, you've done this more than I have, specifically with revenue cycle. What are some of the problems and challenges you see, and then how have you helped them with those things?
Yeah, Carl, revenue cycle to me is the lifeblood of a healthcare organization because it's their revenue. Like with any business is, it can all be solved with more revenue. All businesses focus on their sales efforts and bringing in as much revenue as possible. In healthcare, unfortunately, it's not that simple like a regular business where, I sold 100 widgets to Karl Baker, and Karl Baker is going to send me a payment for the amount of the widget. You get into healthcare and you get all these fun things called contractual adjustments and contracts and write-offs and timely billing and all these a million different things that get involved, where you made a sale, but you may not ever see that revenue, or you may only see part of that revenue. Kind of by design, it's complex because healthcare payers know that not all organizations have the resources to have the tools that are out there to make sure they're getting paid and make sure that they're working the most efficiently and collecting what's due to them. We'll hear, organizations will tell me when I come in, oh, we have a denial problem. And I said, okay, so we'll look at the denial problem, but how do you know you don't have an underpayment problem? Well, if you've never looked at it, then how would you know if you've been paid correct? I find organizations where I've gone into, they've had denial issues, and everybody has some denial issues, and they may be working on mitigating those and keeping them under control and reducing their bad debt write-offs, but they never look at their payments. A lot of them still will take what the insurance company pays and says, oh, well, we billed out, say, for a group of claims, $300,000. The contractual or the discount was $150,000. We got $150,000. That seems about right based on what we've seen in the past. And so therefore we write it off and we bring the receivable down to zero. Well, how do you know you shouldn't have been paid $180,000 or $190,000? And many times you got more of a problem in underpayments than you actually do in denials. So those are things that, and the whole thing is, there's so many pieces that touch the revenue cycle that need to be looked at.
So in that example, and I've heard that as well, actually the rule of thumb that I've applied with healthcare enterprises is, rule of thumb, a healthcare enterprise's net patient service revenue is probably about 1% lower than what it should be if you were to do a contract analysis and look at the total contract. So if an enterprise has $100 million, their actual collected revenue opportunity probably should be $101 million or $102 million. And if you put systems in place, that's $1 or $2 extra million that goes straight to the bottom line. I'm assuming there needs to be some sort of a systemic approach to evaluate, in your example, that whether that $150,000 was right. There's staffing issues. They don't have time. They think they don't have time to challenge that, but they need to have some sort of a system in place to evaluate whether the 150 should be 180 in your example. How do they do that?
Yeah, and you're absolutely right. And you're right. They don't have the time. And I've heard many organizations say, oh, our CFO's doing that, or this one's doing that. And, in most cases, they're up to their eyeballs in just the day-to-day of keeping the place running.
Just transaction posting,
yeah, transaction. I mean, you can say people are doing all this stuff, but how much time do they have to do that? What always amazed me in healthcare organizations, and it's just the way it is that people will diagnose without ever doing an analysis. So they know they got a denial problem because they didn't get paid. Okay, so that's pretty easy to diagnose, but it'd be kind of like going to the doctor's office and saying, I got a sore throat and, I haven't been sleeping well. And then the doctor comes, you come in the office, he goes, oh, here's a prescription for you. See you next, in a month. Well, you never examined me. You never diagnosed me. How do I know that this is what's wrong with me? And
Right.
that's the thing. I mean, some organizations do it, but to do a complete analysis of their revenue cycle usually more than pays for itself many, many times over. Because you may find out that certain payers have been underpaying you. Certain payers have been denying you, have high denial rates compared to others. Certain organizations are not following their contract, or they're not paying timely, and there's just a list that goes on that that you look at, from front end collections, registration problems. I mean, the list goes on, and those registration problems eventually become a payment problem. The right way is to look at the whole revenue cycle from start to beginning to find all the problem areas to fix. And you're right, if you have systems in place like contract management software and people that know how to use it and have the time to use it, you're going to recover lots and lots of money, millions and millions of dollars, especially in a lot of the managed Medicare government payers. Yeah. And the software is relatively inexpensive compared to what you're going to recover. And that's why you have a lot of people selling it or offering that service.
I'm assuming for a typical organization, they're going back to that example of the one batch payment of 150,000. They don't have the time to look at individual ones. But if you're doing what I'm calling spot audits, or identify the top 3 contracts that you have and challenge some of those payments on a periodic basis, you can evaluate whether you're being paid in accordance with the contract. And most likely, in our experience, they're going to find dollars there that weren't readily apparent before you did that analysis.
Yeah, I mean, back in my earlier days, I worked for an organization, and we sold outsourcing services for workers' comp motor vehicle claims. And what we found, because we had software, we had a lot of systems the hospital wouldn't have, because it might be 1% to 4% of their revenue. But many trauma centers had people come in, they get in an accident, they come in, they give them their Blue Cross card, and that accident could have been paid by their motor vehicle at 100% of charges versus 60% of charges, okay? And when you start looking at trauma centers where 1% to 4% or 5% of their revenue are coming from trauma, not only that, you've got workers' comp, another one that could be paid at 95 to 100%. You're talking millions and millions of dollars when you don't have the system to prove. And these systems can search by trauma code, they can search by all kinds of different things. So you can look for motor vehicle accidents, and then you go look at the registration. Do they have the motor vehicle insurance company on there? Was they a driver? Were they a passenger? All that's on police reports most of the time, but how many organizations have access to police reports? They don't, but outsourcing companies do, and that's where you can make millions and millions of dollars of returns for organizations. And that's just in one area. That's just workers' comp motor vehicle. We're not looking at underpayments and, on just regular contracts, as you mentioned, Blue Cross versus United versus, Medicare.
I think the point is, if an organization is not doing something to evaluate whether payments are being paid in accordance with contract, that's a great place to start. I liked your point that denials are easy to identify. You're either getting paid or you're not, but realistically, even when you are getting paid, you're very possibly not getting paid the right amount, and that's where the find is. So having good systems in place and evaluating those on a good spot check basis, or using effective use of technology most appropriately, is a good way to look at that. I'll end it there. Any of the final comments, Bob?
Yeah, I just think the days of yesteryear where you didn't really worry about that too much. You had margins, and you could go, if you're a nonprofit, you just ask the government for more money, cost-based reimbursement. Those days are gone. You can't leave any money on the table, and you have to start thinking like you're running a for-profit business, because even if you do get cash, or your critical care hospital where you still cost-based reimburse, eventually the government is going to look at competition and say, well, if it costs this much here, and it costs this much at another facility. Why am I sending patients here when I can get it done cheaper somewhere else if they're
Right.
efficient? So eventually this is coming. May not happen overnight, but you're always going to be in a much better position if you look at it that way.
Yeah. Boy, that could be a whole different subject, the concept of culture and approaching the business from a profitability perspective. That could be a whole nother subject. But hey, good conversation, Bob. Thanks. We'll talk to you soon. And if you hear this and you're listening to this and watching this video, first of all, thank you. Thanks for your time. You can find our website, bakercfoadvisory.com. Like and subscribe to this channel. Our email is info@bakercfoadvisory.com. Our phone number is on our website. Happy to have a conversation with you at any point to see if we'd be a good fit to help you. And feel free to check those out and come back to us. Thanks a lot. Bye-bye.